Hello, you're welcome to another lecture on midwife care of the newborn. Today we'll be considering this important topic in midwifery. My name is Dr. Esther Kikeloma Folabi from the Department of Nursing Science, Obafemi Awolowo University. And we are going to be considering this particular area of interest under the following objective. We want to look at the features of an healthy newborn, describe the general care of the newborn, and also look at post-delivery routine care of the newborn, implement midwife's care of a newborn, such as instructing parents on how to care for their newborn. I want to also inform you that, as you all know, the care of the newborn is an integral part of the role of the midwife. So caring for the newborn is one of the critical roles a midwife plays in the child, in the family, to welcome a new child to the family, and also one of the duties of a nurse, of a midwife. So nursing care of mothers and their newborn infant is often taught as an excited moment and rewarding experience for the midwife, because a brand new person is welcomed into the world. So what are the features you see when you see an healthy newborn? One, an healthy newborn is given birth to at term between 38 to 42 weeks and should have an average birth weight. You should cry immediately following birth. You should be able to establish independent rhythmic respiration and quickly adapt to the changed environment. So any deviation from these features may show that there is need, or there's an urgent need for further care or further management for this newborn. So what are the care that is expected of you as a midwife when welcoming a new child to the world? And this care include immediate and thorough drying, normal breathing, cord clamping and cutting after first minute after birth, thermal protection, early initiation of breastfeeding and exclusive breastfeeding, and protection from infection. So we are going to look at this care one after the other, and we'll try to expatiate more on this care of the newborn. So the first one is immediate and thorough drying of the baby's body. Immediately after childbirth of a normal delivery, the midwife gently clears mucus and other materials from the mouth, the nose, and the throat with a suction bulb. And so this involves a skillful attention or skillful duty of a midwife in order to know how to clear the mucus, and other material from the mouth, the nose, and the throat. This is very important because it helps to prevent aspiration, or it helps to reduce, it helps to establish airway for the new baby. And so the next care is normal breathing. The newborn is then able to take a breath immediately after the airway has been cleared and the airway is established. So you assess the baby breathing at this time of drying, and this is very, very crucial. Ability of a midwife to assess the baby breathing is a golden time, which, if it is not properly done, it can lead to damages for the newborn. So at this point, we remember the ABGAR scoring, which is 1 minute and 5 minutes. And we refer to this time as a golden time for the newborn. A low ABGAR score is a sign that the newborn is having difficulty and may need extra assistance with breathing or blood circulation. And so once the baby is stable, the nurse can obtain other care, other measurements, other thinking. But at this very crucial time, it is important that the nurse look at the scoring, the ABGAR scoring of the baby. And what do we mean by this ABGAR score? The A stands for appearance, the P stands for pulse, and the G stands for grimace, and A stands for activity, then the R stands for respiration. These 5 are cardinal points that a midwife have to look out for within the golden minute of life of a newborn. and it is usually related from 0 to 2, with 2 being the best score. So we'll look at for the appearance of the skin of the baby, if it is blue, if it is pale, if the extremities are blue. But if the baby is pinkish in color, there is no cyanosis. That indicates that the appearance is good and the baby will be able to score 2 points. For the pulse, we look at if the pulse is absent, that is 0 point. If the pulse is less than 100 beats per minute, that is 1 point. If it is above 100 beats per minute, that is 2 points. And also for the grimace, we want to look at the response of the baby to stimulation. Is it flappy? Is it floppy? Is the baby responding to stimulation? If he's not showing any sign of response to stimulation, then we talk about a 0 point. And if the baby shows sign of grimace on the suction or after suctioning, it becomes quite aggressive with the grimace is showing some sign, but after being suctioned, then it takes 1 point. And if there is cry on stimulation, that is 2 points. For activity, if there is no activity, is 0 points. If there is some flexion of the arm and the leg, that is a point. And if there is active flexion against resistance, that is 2 points. For the respiration, we also want to check out if the respiration is absent, that is 0 point. And if the respiration is weak and irregular or slow, that is 1 point. If there is strong crying and the respiration is regular and it's strong, then that is 2 points. So this is what we refer to as the golden sign, the golden rule for the care of the newborn immediately after childbirth. So it is always very important for the midwife to be able to differentiate and also to look out for these cardinal signs when assessing the baby during drying process, when you are doing the immediate cleaning up and the drying of the baby immediately after childbirth. So I have also this sketch to show you that what are you looking for when you talk about normal breathing. What do you look out for? Breathing or crying, good muzzle tone, color pink, that is good, skin to skin contact. But if the baby is not breathing well or there's no good muzzle tone and the baby is not pink, then they may need neonatal resuscitation. So if the baby is crying vigorously and is breathing adequately, then no intervention is needed. But if the baby is not breathing well or is gasping, then a skilled care in the form of positive pressure ventilation may be needed at this point, which is very, very crucial for the baby and for further development of the baby. So this is the diagrammatic flow of when resuscitation is needed, and this is being developed by the World Pediatric Association, which this was updated last in 2016, and this is what still trying to back up what I've told you about how to assess and how to look out for the golden signs immediately after childbirth. So the next care of the newborn is the cord clamping and cutting after the first minute after birth. So 2 clamps are placed on the newborn umbilical cord side by side, and the umbilical cord is then cut between the clamp. It is important for you as a midwife to wait for 3 minutes or until the cord stops pulsating before cutting this cord. This is to allow for you to know when to clamp the cord. So it's important for you to waiting for 3 minutes until, or when you discover that there is no more pulsation at the cord before you now clamp it. Then you apply a sterile tie tightly around the cord at 2 cm and 5 cm from the abdomen. So you cut between the tie with a sterile instrument. So and observe after cutting this, you have to also keep an eye on it to observe for any oozing blood every 15 minutes. If blood oozes, you have to place a second tie. And there is no need to apply any other substance on this stump after cutting. Just make sure that you do the tying with a sterile tie, and then you just watch out for any blood oozing out from that stump site every 15 minutes. And do not bind or bandage the stump. Leave stump on cover for fresh hair. So another care of the newborn is the thermal protection at delivery and after delivery. So I'll be talking about this thermal protection at delivery and after delivery. At delivery, ensure the delivery room is warmed, like 25 degrees Celsius room temperature, or to 27 degrees Celsius room temperature, and make sure there's no wind breeze blowing around. The place is calm, and make sure that dry the baby immediately and remove wet clothes after drying the baby. So you then wrap the baby with a clean dry cloth to create warmth. Keep the baby skin to skin with the mother. So immediately you clean up the baby, and you make sure that you put a clothing that is soft, made of cotton material, not too heavy. You can do a 2-layer. After wearing the clothes, then you wrap the baby up and place the baby with the mother skin to skin to allow for bonding to take place and to also generate heat and thermal protection also from the mother's skin. So after that is at delivery. Then after delivery, we keep the baby clothes well clothed and wrapped. Cover the baby's head. It is important to not to allow breeze to blow so much into the baby's frontal. So you keep the baby warm. Cover the head of the baby. Usually we postpone bathing, particularly for small babies, till maybe few hours after childbirth, but the baby is properly cleaned up. Keep the baby close to the mother. And for low birth babies, usually we advise for use of kangaroo mother care, and that is the picture that I'm just showing beneath. That is how to position for kangaroo mother care, in which the baby is wrapped with the mother skin to skin, and show the mother how to avoid hypothermia and to recognize such in case there's need, if the baby is showing some level of hypothermia. So if you look at the picture beside the slide, you will see that is kangaroo mother care, in which the mother have to clothe the baby and put her on her chest and wrap the baby. So she wraps the baby at the front and cover her up. So that is to promote thermal heat and also to make sure that the baby gets enough warmth as much as possible. And immediately that has taken place, breastfeeding can be initiated. There's no facts and hard rule about when to start breastfeeding a baby. As soon as the mother is stable and the baby is taken to the mother's side, breastfeeding can be initiated. So then after this, there's need to do this newborn identification. Before a baby leaves the delivery area, there's need to have an identification bracelet with identical number are placed on the baby and the mother. So baby often have two on the wrist and on the ankle. This is just for baby identification, as we all know that there may be more than one baby given birth to at the same time. But this means this form of identification helps to identify with the baby's mother, and so that there is no mix-up in terms of who carries who is the mother of any of the child, of the baby, of the newborn. So usually, depending on the hospital policy, vitamin K are usually given to neonates, to newborn babies, to prevent neonatal hemorrhage during the first few days of life, before infant is able to produce their own vitamin K. So depending on the hospital policy where you work or where you find yourself practicing as a midwife, if it is something that is recommended in your facility, you can also administer that. So usually for term infant, 1 milligram is given as IM. For preterm, 0.5 milligram 0.5 milligram is given, IM, and the alternative route is oral dose of 2 milligram orally at birth, and this may also be repeated. 2 milligram may be repeated at 2 to 5 days and at 4 to 6 weeks of age. So after that, then, like I told you, that mothers who are in the early initiation of breastfeeding is advised for mothers with normal newborn babies, with healthy newborn babies. So mothers who are breastfeeding put their newborn to their breast within first 30 minutes after delivery. So, and this breastfeeding stimulates oxytocin, hormone that helps the mother womb to heal and promotes development of milk supply. So that is why it is important to initiate this initiate breastfeeding early, because it will help the mother. It will also help the baby. The baby will be able to get enough breast milk supply, while the mother will also will have developed healing process of her womb. And as you can see, so I put the picture above for you to see the proper positioning of mother to the baby to breast for breastfeeding mother. So it is important that as a midwife, you know how to position this baby to breast to the mother, so that the baby can suck effectively. If you look at the way the mother is carrying, usually, you know, some mother, they do this scissors type. No, that is no more encouraged. You know, she places her forearm on the breast, while the remaining 4 fingers were placed underneath the breast to support the breast, in order to also help in the expression of the outlet for the breast milk to flow. So but I want you to note that not all deliveries follow a standard pattern. For example, some women need to have a cesarean delivery, or some women have complication of labor at delivery. So if there are any a situation like this, the mother may not be able to initiate breastfeeding within the first 30 minutes after the baby has been born. So, and that does not call for any agitation, but as the situation warrants, you also have to go show your skill as a midwife in order for you to promote early initiation as soon as the mother is stable and can start breastfeeding a baby. So the next point is protection from infection. And there is this 5 clean that is being advocated by WHO. At delivery, we have hand of attendant, wash with soap and surface for delivery, cutting instrument for cord, using of a razor blade, a new razor blade, and also the string to tie cord, and also clothes to wrap baby and mother. So at delivery, it is emphasized that you, as the attendant that will be taking the delivery of the baby, you have to make sure that you are clean, your hands are clean, and you also make sure that the surface in which you are receiving the baby is also clean, is sterile, it is free from germs or any other thing that may cause nosocomial infection. And also, whatever you are using to cut the instrument for the cord, either razor blade or the cut clamp, must be something that is sterile and is clean, that will not promote infection. And also, wrapping of the baby, you make sure that the clothes you are using to wrap the baby or the clothes the baby is wearing is clean, it's free from odor, it's free from dirt, it's free from dust. So after delivery also, you have to make sure that you continue the hand washing technique before handling so make sure you wash your hand before handling the baby to the mother. Keep the cord clean and dry. Do not apply anything to the cord. After you've cut and it's remaining the stump, don't apply any other thing. Just make it clean and dry. Usually we use methylated spirit to keep it dry, and use a clean cloth as diaper or napkin. And each time you change the baby's diaper, or you change the baby's diaper or remove any soiled materials from the baby's body, it is important for you to wash your hands. So then after this, so these are the immediate, like a 24-hour care for the baby that we just finished talking about. Now we'll talk about post 24 hours after childbirth, what are other routine care that we give to the newborn? So one, the ultimate aim of this routine care for the newborn after the first immediate 24 hours is to establish and maintain homeostasis and also the adjustment to normal physiological status. And this is the ultimate goal. This is the main goal of this subsequent care of the newborn. Establishing and maintaining homeostasis, adjustments to the normal physiological state. You know, the environment in which the baby is now he or she finds herself, either the baby and the mother find themselves is another environment that they have to adapt to and they also have to adjust to. And this also involves some psychological changes in the way the mother is going to be handling things because of another addition that has been added. And also for the baby is also finding him or herself in another environment totally that needs adjustment to life for further development and growth. So this post-delivery routine care of the newborn involves warmth, breastfeeding, skin care and baby bath, care of the umbilical cord, care of the eyes, clothing of the baby. So, and also general care, observation, taking anthropometric measurements, immunization, follow-up, and advice. So for the first one, which is warmth, we've talked about wrapping the baby. Make sure that this first few days after childbirth, it is very, very important to keep the baby in a warm environment that will not lead to hypothermia. It is important that we wear a very good clothing for the baby that is adequate to meet the thermal protection for the baby. Baby should be kept by the side of the mother, and at this point, mother warmth and the baby warmth should be encouraged and bonding should be promoted at this stage. So any clothes the baby is wearing at this stage should be soft, should be made of cotton, not with fiber or not with a synthetic material that the baby's skin may react to, but soft clothing, light clothing. It can be 2 layers depending on the weather or the temperate region in which you are practicing. But however, whatever the baby is put on, make sure that it is adequate clothing that can generate some warmth for the baby. And also help the mother in her first few attempts to breastfeed. Usually for primigravida, someone giving birth to a baby for the first time, or that's the first child the woman will be carrying following childbirth, it is important that you help them on how to breastfeed their baby, because some of them struggle with this at this point. It is good that you encourage them in their positioning while sitting to breastfeed their baby. They should sit down properly with their back supported so that to prevent any strain on their back, and make sure that when they carry their baby, the baby is facing them with the abdomen of the baby touching that of the mother to promote bonding, while the nipple, not the nipple now the mouth, the nipple of the breast and your areola fully enclosed in the baby's mouth for easy outlet of the breast milk. So we have to support them, we have to teach them at this time on how to breastfeed their baby effectively, and so also to make them comfortable, both the mother and the baby to be comfortable. Then skincare and baby bath. Baby bath can be given at the hospital or at home by using warm water in a warm room gently and quickly. And so the first bath, once the baby temperature has stabilized, the first bath can be given. So that means that the first few hours after childbirth, the baby's temperature is being monitored, so to determine when the baby's temperature is okay for the first bath. And also for care of the umbilical cord, keep the cord stump clean and dry. Topical application of antiseptic is not usually necessary unless the baby is living in a highly contaminated area. So if the baby is not living, if they are not working or you are not nursing a baby in highly contaminated area, there's no need for any antiseptic application, topical application on the stump of the breast. But always make sure you clean the stump of the cord after it has been ligated. You clean with methylated spirit and you clean inside out. You with stroke, gentle stroke, with a firm stroke, then you clean. You don't clean roughly, you clean gently with a stroke, and you keep it dry as much as possible. Care of the eyes. Clean eyes immediately after bath with a swab soaked in sterile water. The rule is what you cannot put into your, don't put anything that is dangerous into the baby's eyes. So clean the eyes immediately after the bath with swab soaked in sterile water. Use separate swab for each of the eyes. Clean from the medial to the lateral side. So, and that is also a picture showing how to clean the baby's eyes. So you clean from the medial to the lateral side. Separate soap for each eye. It's very important. Don't use the same soap you are using for the right eye for the left eye. You can also give prophylactic eye drop within 1 hour of bath as per hospital policy. So depending on where you work, if it is something that is recommended, you can do that. Do not put anything else in the baby's eye. Then clothing of the baby. The baby should be dressed and wrapped with loose, soft and cotton cloth, ensuring the head and the extremities are well covered, because baby loses heat through evaporation, radiation, conduction and through convection. So please make sure that the baby is properly clothed with clothes that are not too thick, not too light, but the ones that can generate good warmth for the baby. So for the general care involves being gentle in approach to whatever you are doing for the newborn, because at this stage of their life they are very fragile, but they are highly sensitive. You should not do anything that will lead to damage or that will affect the growth of the baby subsequently. So make sure that you are gentle in your approach in whatever, either you are bathing the baby, either you are cleaning the eyes, either you are changing the diaper, either you are doing your cord care. You have to be gentle in your approach, and make sure that for any of this procedure, for any of this activity you are carrying on the newborn, you perform aseptic technique, and make sure that you limit the nosocomial infection as much as possible in your care. Make sure that anything you do it with aseptic technique, and also you have this sensory stimulation to sensitize all the other reflexes of the baby, and make sure that you do that gently. Also provide a tender and loving care for both the baby and the mother. Let them see you like a source of comfort to them. Let them see you like someone as a midwife that they can rely on and they can get this tender and loving care from. Also, as a midwife, you can examine the newborn. You have to examine the newborn for any obvious abnormality or sign of distress. And this you have to do like every 15 minutes, like checking of the temperature, checking the pulse, and also to see that the respiration of the baby is regular and it is strong. Usually the body temperature for the baby under the arm is like 36.5 to 37.4 degrees Celsius, and at the rectal region, if it's taken by the rectal, it's like 37.9 or less. So please make sure you check. These are ranges for the body temperature after the baby is being born, and usually a full physical examination comes later, typically within 24 hours of birth. And the baby should be kept in continuous observation twice daily for detection of any abnormality. Like I told you, the first few days after childbirth is very crucial and it's very critical in a baby's life. So any deviation from normal should be quickly reported, and prompt intervention should be put in place. And that is the duty of you as a midwife, to take note that any deviation from normal, you should report promptly so that intervention can be put in place to reduce the damages or to reduce the trauma from this childbirth process as much as possible. Also, routine care follows taking anthropometric measurements such as measuring the baby's weight on daily basis while the baby is still on admission or still in the hospital before it's been discharged home. It is important that you check the baby's weight. An average daily weight gain for elder baby is about 30 grams per day in the first month of life. Also, you measure the length of the baby. Average range is between 18 to 22 inches. That's 46 to 56 centimeter. You measure the head circumference. And this, in case there is molding, you have to repeat or caput. After it has been resolved, you still have to measure this head circumference, and the normal range is between 33 to 35 centimeters. So you keep an eye on this. The chest circumference is between 30 to 33 centimeter, and also you also want to measure the mid-arm circumference, which ranges from 8.2 to 9.7 centimeter. So it is important that you keep an eye and you understand the ranges for this anthropometric measurement as a midwife, so that you know when it's looking as if there is increase or the baby is not growing the way it should, and which you may need to involve other experts in order to, because when it comes to the issue of childbirth and caring for the newborn is a team approach. So when you notice anything, it's good for you to document as a midwife and also communicate appropriately to other team members for further investigation and prompt management. Also, it is important that for all this daily weight you are checking, you keep a record of it, because that can use to develop or to have a chart of the pattern of growth of this baby. So it is important that you keep the weighing record, the birth weight record of this baby for the first 1 year. You start right from the onset of childbirth, and you keep monitoring, and then you can be checking. But in the first few weeks of life, there is physiological loss of body weight due to removal of veins, mucus, blood passing of meconium, and reduction of extracellular blood volume. So, but usually with a baby that is well breastfed, the baby regains the weight within 7 to 10 days. And that goes on and on. And most babies double their birth weight by 4 to 5 months. So it is good for you to know or to understand this concept, these principles, and also understand these indicators for you to be able to provide your duty, a skillful responsibility and roles as a midwife. Also, at birth, the baby needs immunization. And at birth, BCG, OPV 0 and hepatitis B are usually included in the immunization schedule plan. Also, this also may depend on the immunization schedule plan policy of wherever you find yourself working, but for these first three are usually given at birth: BCG, OPV, and hepatitis B. So what is your role as a midwife in caring for the newborn in terms of to follow up and advise? So your follow-up is necessary for assessment of growth and development, and for early detection and management of health problems. So you need to follow up, because if you don't follow up on this newborn through their life processes, developmental stages, you may not be able to detect early if there is need to put some intervention measures for this newborn. So it is important that each infant should be followed up actively for the first 6 weeks to the first 3 months, and subsequently 3-month interval till 1 year. So your role as a midwife, you need to follow up on this and also give some advice that are beneficial, that will help the mother in taking good care of this infant at this stage. So you counsel the mother should be given to the mother during the hospital stay and at the time of discharge, particularly on exclusive breastfeeding, warmth, hygienic measures, and immunization. So you should be able to talk to the mother of the child that it is important for her to do exclusive breastfeeding. And what do you mean by exclusive? Giving the baby breast, just breast alone for the first 6 months of life, and also the importance of creating warmth for the baby, carrying every activity for the baby after being discharged from the hospital under hygienic measures, and also the importance of immunization, having their babies giving them the appropriate immunization as when recommended. So, and also it is important for you as a midwife to also be able to tell the mothers the danger signs related to childhood illnesses should be explained in a way that the mother and the family members will understand and they can comprehend. Make sure that you speak to them in a language they will understand you, in a manner that they will be able to comprehend what you've said. There are some danger signs that they should look out for, even after taking the child back home, that can help that is related to childhood illnesses, and this should be explained in details to the mother and to other family members, because their support also counts at this crucial time when the baby is moving through the transition phase from being an infant and is also growing at to achieve the milestones of child development. So in summary, we've been able to look at the care of the newborn right from the golden time up to some few months of childbirth. So call out the time of the baby, receive the baby onto a warm, clean towel and place on the mother's chest. The importance of clamp and also to cut the umbilical cord. It is important to know that the midwife needs to dry the baby with a warm, clean towel or a piece of cloth. Accept baby's breathing while drying is very, very crucial. Wipe both eyes separately with a sterile gauze piece or a pad. It is important to put the baby to breast for skin-to-skin contact, and if there is a need to put under the resuscitator, also it is important to cover the head of the baby to make sure that the baby is getting enough warmth. It is important to have an identity label on the baby, and also the need to initiate breastfeeding as early as possible. So I have some of these for further reading. You can check some of this, which will also help you in understanding this concept we've discussed. So thank you for your kind attention.